Hello and welcome to Close Up with Kamalika's latest episode. It's lovely to come back to see all my guests after a long time. Um, and we today are going to talk about women's mental health in particular. And my guest today is Mrs. Mousumi Sengupta. This is a little introduction for Moshumi. Before that, before I give the introduction, uh, welcome Moshumi to Close Up with Kamalika's latest episode. Thanks for coming to join us today.
Thank you. Thanks for inviting me.
So here we go. So Moshumi is a person-centered therapist based in South Manchester. She's a member of British Association of Counsellors and Psychotherapists, BACP. She works as a counselor at an NHS partner organization called NUPAS, and she's also associated with an organization that specializes in rehabilitating victims of domestic violence and honor based crimes. Um, Her main focus areas are grief and loss and bereavement, anxiety and depression, pregnancy loss, counseling for peri-menopause or menopause, and complex post traumatic stress disorder. She does sessions online and in person. Is that right, Moshumi?
That's correct. Thank you, Kamalika.
Okay. So before she became a counselor, she spent years in education as a teacher in India and in the UK, and she worked closely with the elderly in South Manchester as well. So, welcome again, Moshumi. My first
Thank you.
question to you would be, what is the importance of therapy, according to you?
Well, therapy, when we talk about therapy, we remember what comes in mind is some kind of disorder. But what I would like to say is that therapy gives any person a safe space and with non-judgmental attitude, without any judgment, uh, to explore thoughts and emotions,
Mm,
where the therapist listens to you actively with a lot of empathy. It is a it is a space where you can reflect on yourself, your thoughts. It is a space where you can heal. It is a space where you can grow also. So, therapy can help you transform your life. Therapy can provide a space where you can um, explore thoughts, as I said, without judgment. And that itself is very healing because we live in a very judgmental society and often we judge ourselves very strongly. We are our own worst critics. So, a therapist obviously builds up that therapeutical relationship with the client to facilitate all this transformation and growth.
that's such a wonderful way of showing us why therapy is so important in today's life. In this very fast paced world, it's very hard to look after yourself and to get the time and make the effort to look after yourself. So it's important that people open up and choose to go to a therapist and find that time and give in that effort for themselves and their own mental health. Thank you
Absolutely.
very much.
Absolutely. And that is why what you mentioned is self-care, and it is an investment in self-care in a very complex, demanding world. Um, and it is a very gentle space where there is no rush, where you can pace yourself. And it gives you that space to look after yourself, basically, with the help of the therapist.
Thank you so much. Thank you. So, coming to today's topic, basically, my idea for my viewers was to give my viewers um, an open ground where they can look into different kinds of therapists. But this will mainly be about women and women's mental health. So I am very interested in talking about the different hormonal changes that happen and are so complex for a woman in various stages of their life, and how that can affect our mental health, basically. So that's why I wanted to speak to a therapist and see how you guys help out women in certain situations. So, my first question to you would be, um, why is perinatal mental health important? I mean, I was reading up something and I found, according to a publication by the Royal College of Physicians, of General Physicians, that between 10 and 20% of women will develop a mental disorder during pregnancy or within the first year after having a baby. Could you throw some light on this and then talk about what care options are available there on the NHS or with therapists like yourself?
Yes, as we all know, like giving birth leads to a lot of hormonal changes, and that can manifest as a lot of things. And few of the most common things or common issues which come up are postpartum or postnatal depression, postnatal psychosis, um, and both are similar but also a bit different from each other. Um, First, I want to make everyone aware that because of the hormonal changes, first few weeks, first couple of weeks are generally very topsy-turvy for the mom. It can lead to mood changes, anxiety, and depression, and it generally lasts, as I said, couple of weeks after giving birth. These are
Hmm.
also called baby blues, and they kind of settle down when the hormonal levels become more normal. So that
Okay.
takes 2 or 3 weeks. But if those anxiety, depression, tearfulness, irritability that continues beyond those 2 weeks, then it can be categorized as postnatal depression, and that
All right.
needs to be treated. So,
Mhm.
postnatal depression can occur anytime within 1 year of the
Mhm.
childbirth, and it needs to be treated either through medication or counseling, or maybe sometimes a combination of both.
Okay.
Um, NHS does provide postnatal depression care through CBT and talking therapy. Um, yeah, I mean, when there is postnatal depression, the clients generally feel there is a feeling of loss of self-worth, loss of self-esteem, loss of confidence. There is trouble sleeping, there is fatigue, anxiety, depression, um, because the societal view of new motherhood is always very rosy, but sometimes the personal experience of the woman does not fit with that picture, and that can be because of complication during the childbirth, which has compromised the bond between the mother and baby, and that increases the distress and feelings of guilt. So in counseling we will look at the situation very holistically, see what is going on, what is the support system, and we would look into the element of loss, like loss of identity, loss of self esteem in a woman, loss of the change in the role, because being a new mother can be quite overwhelming. So all those things we will look into, and there would be, if when there is loss, we know there is grief, and grief can manifest itself in a various ways, like fear, anger, um, anxiety, depression, even.
Great. You've gone into a great deal of detail on this answer, and thank you very much for this. So we are going to move on to our next question now, which is to do with puberty and adolescence.
Mhm.
So, common mental health disorders in adolescence include those related to anxiety, depression, attention deficit, hyperactivity, and eating disorders. Can you throw some light on what kinds of problems your patients or your customers come to you with?
Well, first, I must tell you that I don't actually work as a children counselor.
Hmm.
So these all fall under children counseling.
Okay.
And that is a very specialized field. But obviously, being a counselor, I am aware of how much puberty affects the mental health of adolescents. So it is a period of very dramatic developmental transitions that lead to various physical and emotional changes in a very complex world again, because
Of
the
course.
world is very complex for young people. And to navigate that, they it doesn't make it easy, all these hormonal changes. And at this stage, because of this changes, the adolescents are significantly vulnerable to mental health disorders. Like, as you said, there can be depression, anxiety, sometimes non suicidal self harm, substance abuse. Uh, it can manifest into many things. And also, I've read up on this. It says that evidence states that girls are more in danger of being adversely impacted than boys.
Okay. I didn't know
Yeah.
that. I was not aware of that.
Yeah, that's what the evidence says. The factors like poor peer relationships, family relationships, physical health, access to
Mhm.
education, they kind of all contribute to the impact on mental health.
Okay.
Mhm.
And what therapies are actually available? Could you throw some light on this?
I think schools or educational institutes, they do provide counseling. In secondary
Mm-hmm.
school, there would be counseling,
Mm-hmm.
or colleges, which are generally very good. School
Mm-hmm.
counselors, most of the time, use person-centered method. They provide a safe space for the adolescent to go and explore his or her thoughts without any judgment, because sometimes all these problems occur because maybe there is no unconditional support, or unconditional support back at home. So that is why this unconditional support from parents are very
Mm-hmm.
important at this stage, because um, the need to belong to a peer group, minimizing rejection, these are very important. So if they are experiencing that in the school, but they can come back to a safe, secured space at home, then the effects can be minimized. It will still affect them, but it can minimize the damage, if that
I
makes
guess
sense.
being a parent, I would just
Mm.
like to add again, I am not into this field, but just being a parent, I feel that when children come home from school and they are experiencing issues in school or outside in the outer world, and if they are sharing their problems or any situation with you, it's so important to give them the time and the space to open up and talk about their feelings and what's going on. Basically, as a parent, you can be a therapist in a way, can't you? And that's a
Absolutely.
hugely important role as a parent, isn't it? That's how I feel.
Absolutely. You have hit it on the nail, because as a therapist, we say that we are reparenting the client, because all those conditions which was probably not available when they are growing up has maybe amounted to the issues they are facing later in life. So life is tough, but if you have that space at home, that acts as a buffer.
That's so true. Thank you so much. Thank you. So, moving on.
Mhm.
So, we've talked about perinatal mental health, we've talked about as adolescents. Um, I
Um,
just want, sorry, go on, please.
Sorry, with the postpartum hormonal changes, I
Mm-hmm.
we did not talk much about postpartum psychosis, because I think that is a very important area which we counselors do not deal with, and it is a very serious mental health condition where it might require hospitalization,
Okay.
and doctors are heavily involved in the treatment. So, and just to make everyone aware of perinatal, postpartum psychosis, they can come up as if a woman after childbirth is severely depressed or become very
Mm-hmm.
manic. There are quick changes of mood, or she's very withdrawn, very confused,
Mm-hmm.
delusional, having hallucinations, wants to harm the baby.
Mm-hmm.
So these are all the symptoms of uh, the psychosis, postpartum psychosis, and that
Okay.
needs immediate hospitalization. So that is something everyone should keep in mind when they are dealing with postpartum women and hormonal changes. So it can happen due to many historic mental health issues, like they might have bipolar disorder or schizophrenia, or genetically preconditioned to psychosis. Maybe their mother or grandmother, they had it. So
Mm-hmm.
I thought this it's very important to mention that.
Okay, so is that why it's a very common cause of direct death in such women? Is death by suicide?
That death by
Is
suicide.
that
Yes.
right?
Yes. Yeah. That is
Yes.
why it is very important to get them into a medical setup, hospitalize them so that they can be medicated and taken care of. And you can get better with right sort of treatment.
Okay, so can you explain the word psychosis for our viewers, please?
Psychosis is not my area, first of all. So it
Mm-hmm.
is, as I said, if you are manic, or there are very quick changes in your mood, there is no absolute no regulation, emotional regulation, you become, there is hallucination, or you are hearing voices, you are being delusional. That is what is called having psychosis symptoms.
Okay, okay.
In a
Thanks.
nutshell, in a very brief
Thanks very much.
way.
Okay, okay. Thank you. So moving forward, um, so we're coming to menopause now. We've
Mhm.
been through the other two major areas of disruption in a woman's life. The third one would be natural hormonal fluctuations leading up to menopause. And there is literature out there which says that this puts women at a higher risk of developing depression. Is this true? And can you tell me what treatments can help?
Yeah, yeah, it is true, because hormonal changes, women are again going through hormonal changes,
Mm-hmm.
and it will affect your moods. It will affect how you navigate the world. So, we all know that during menopause, the estrogen levels fall, and that lots of physical symptoms come up, like night
Mm-hmm.
sweat, hot flushes, brain fog, and the emotional symptoms like depression, anxiety, due to y- generally you go through insomnia that also produces fatigue, irritability, high level of distress. So they are all very interconnected. So physical symptoms giving uh, producing some emotional distress or emotional symptoms as well.
Mm-hmm.
Um, and also, the menopause happens during the midlife, when you are already having a lot of life stresses, like parental ill health, adolescent children, then sometimes children leaving, so which is called empty nest syndrome, uh, career demands, uh,
Stress at work is such a big
stress
thing,
at
isn't it?
work. So obviously, at that age, the chances are you are in a very responsible position, and that creates a lot of demands on you while you are going through all these physical problems like night sweats and brain fog, that amounts to difficulty in concentration. So all this makes it a very, very difficult juncture for women. NHS provides CBT for this, and obviously there are hormonal therapy, HRT, which can be very, very helpful. Um, so women, who are going through menopause should go to the GP and talk about what problems they are facing. There is also sometimes antidepressants are prescribed,
Okay.
that also helps with the conditions. And then therapy can give you again a very safe, non-judgmental space where you can talk about your issues without any judgment. And as a therapist, when a perimenopausal or menopausal woman come to me, I would
Hmm.
prioritize their unique perspective of their experiences, what they are going through, and validate them, validate the sense of loss, which sometimes occur because it feels like it is a loss of self worth, self esteem, loss of confidence, sometimes loss of youth also. And it would give you, a space to reflect on that and heal. And the main objective would be to empower the woman to manage their well being, to know what is best for them.
True, true, true. So that is why therapy is so important, because this is mostly self help, isn't it?
It
This
is,
is to
yeah.
know that you need help and to approach someone for that help.
For that help, and then giving them the tools so that they can help themselves in future. They are not dependent on the therapists.
Hmm.
So to make them more autonomous,
Okay, and
that is the
how would you do that? Could you give me a couple of examples maybe of what you
it is
would
not
use?
obviously a quick fix.
Yeah.
It would take time. It would, when you have a safe space to explore your thoughts without judgment,
Hmm. Hmm.
that gives you an opportunity to go through your past issues, whatever you have come across in life, because we
Hmm.
all carry uh, trauma or lots of emotional baggage. And if we can share that in a safe space, and
Hmm.
we can, that weight sort of comes down, and that makes you, uh, that gives you the clarity of thought sometimes, and that makes you more self aware. And when you are self aware, you are not reacting, you are more kind of responding. So that is a growth in itself.
That's true. So counseling provides all this as a holistic kind of place where you can just
Yes.
open up.
Yes.
And how exactly does a counselor help people um, to talk? Is it through questioning? Would you give advice as such, or would it be questioning mainly, probing questions?
No, not at all. We won't do any probing questions at all.
Okay, okay.
Because when you start questioning, then you are not using your emotions, you are using your cognitive brain. You are thinking more than you are feeling. So counselor, generally we say that we don't listen to the story, we listen to the emotion that is at the background of the story. and we reflect that emotion. And that helps the client to open up, feel understood. And that is a feeling. Feeling understood is a feeling, is an emotion. And when you feel understood, you would feel like sharing. You will feel that this is a safe space where I can talk, and they would
Yeah.
exactly understand my perspective. So that is how we build up that therapeutic relationship. And that is the foundation of therapy.
Okay.
And we
But would
don't,
you
sorry, the next part of your question was advise. We don't
advise?
advise because we believe that you know the best solution for your problem. So what we will do by reflecting and by listening
Mhm.
to you, we will guide you towards your own solution. You will come up with your own solution. But saying that, this is the ideal picture, saying that when I talk to a say I'm having session with someone who has been a victim of domestic violence, her whole world has fallen apart, then obviously we will give them some coping mechanisms, coping tools, which would help them to rebuild their life. And at the same time, they will work on their shame or, loss of self-esteem, uh, which happens when you are victim of such a crime.
Very true. Very true. Well, thank you very much for shedding light on all these issues and how someone like you can help women out there. Um, would it be okay for you to share your email address or your contact number, which I can then leave in the comment section for our viewers if anybody wants to approach you? Um,
Yes. Yeah, that is fine. You can approach me through Psychology Today. You can call me. I can provide you my phone number. I'm in the process of creating my own website, so
oh, great.
I can share the web address with you. So yeah, I am out there, so you can find me if you want.
Okay, that's great. Well, thanks a lot, Moshumi. I think we've reached the end of our session. I'll just quickly check if there's any other questions that's left. Mainly, I wanted to talk about, managing mild to moderate problems through psychological interventions, which you have talked about so eloquently and so openly. So yes, I think that should be it. That's the end of the session, and thank you so much for making the time of uh, coming and speaking to me, myself and my viewers. And we hope to see you again in some other episode and talk to you about maybe other issues.
Thank you, Kamulika, for having me. And as I said, these are huge subjects, and this is not does not provide us the time to explore every aspect. But I think your questions were very it touched the important parts, and people would be aware listening to your questions and my answers, hopefully, that what they can expect and what can be the solutions.
Absolutely, it's out there to help people.
Mhm.
If even one person finds a way to feeling better through this, then
Mhm.
I guess we have done something that should be, that we should cherish. That's how I feel about this. So thanks
Absolutely.
very much again, and
Thank you.
see you soon. Okay,
See
bye
you.
for now.
Bye
Bye.
bye.
Bye.